And now I'm going to ask Johan Mora-Valverde to explain how to use the closed captioning and be able to access this information in different languages.
Good afternoon. And again, this is Johan. In order to use closed captioning, you want to make sure you can click on the CC icon or closed caption icon, however, shows on the bottom panel of your screen. For those who may be joining on in Spanish, uso de subtítulos traducidas. Los subtítulos deben poder verse automáticamente. You should be able to automatically see those captions. But if it's not like that, si no es así, please select Show Subtitles or Mostrar Subtítulos and click in the bottom up arrow in order to see more languages. Or haga clic en el botón de intercalación hacia arriba. And it'll say Translation to, and you can select your icon as you see on your screen. Cannot see on your screen. En sección traducir del menú, you want to click on the language that is most appropriate to you, or click en el idioma a que desea traducir los subtítulos. And haga clic en la opción para ver más idiomas disponibles. If you do want to see more languages, you can click more, the right arrow on the right side, and you'll see any other language that you want available. If you have any questions, please include in the chat, or you can let us know at any time for support. Thank you, Diana.
Thanks, Johan. So this webinar is intended for members of the New Jersey Council on Developmental Disabilities networks. It introduces the legal requirements to provide language access under federal law. It summarizes the New Jersey Council on Developmental Disabilities Language Access Plan, and it provides information on language access resources. So why should we, including the New Jersey Council on Developmental Disabilities, provide language access? First of all, there's a commitment to serve all individuals with developmental and intellectual disabilities and their families. There's also a growing need for language access services and increasing focus on closing the gaps in terms of access to services and supports and positive outcomes for individuals with intellectual and developmental disabilities and their families. It's also important because it's a funder priority. So the U.S. Department, different U.S. agencies that fund organizations like the New Jersey Council on Developmental Disabilities have prioritized language access for all of their grantees. And last, but certainly not least, there are legal obligations. So let's talk a little bit more about some of these topics. So if you look at the growing need for language access services, according to the American Community Survey, which is part of the U.S. Census Bureau, about 20% of the U.S. population and 23% of students speak a language other than English at home. Almost 10% of the U.S. population speak English less than very well. For 6 of 9 access barriers that were studied, parents with limited English proficiency were less likely than English proficient parents to bring their children to the doctor for needed care. And more than 655,000 limited English proficient children receive special education services, about 14% of the limited English proficient population in schools. So what is the language data in New Jersey? Over 1 million New Jersey residents age 5 and over speak a language other than English at home and speak English less than very well. The top languages are Spanish, where you have about 1.4 million people in New Jersey speak Spanish, and over 500,000 of them speak English less than very well. So about 43% of the Spanish speakers in New Jersey are limited English proficient. We have almost 120,000 Chinese speakers. About 43% of those are limited English proficient. We have over 75,000 Korean speakers, and over half of them are limited English proficient. We have about almost 85,000 Portuguese speakers, and almost half of those are limited English proficient. We have over 80,000 Gujarati speakers, and 37.5% of them are limited English proficient. There's almost 60,000 Polish speakers, over 40% of whom are limited English proficient. There's over 71,000 Arabic speakers, and over 32% of them are limited English proficient. And we have almost 55,000 Haitian Creole speakers, over 40% of whom are limited English proficient. And this data all comes from the census data. So we know there's a growing need. There are a lot of individuals, again, as we said, over 1 million New Jersey residents age 5 and over who have limited English proficiency. That is, they speak a language other than English at home, and they have limited English ability. But let's also think about some of the negative outcomes of the lack of language access. In healthcare, language barriers in healthcare lead to miscommunication between medical professionals and patients, reducing both satisfaction and decreasing the quality of healthcare delivery and even patient safety. They lead to lower quality of care, poor clinical outcomes, longer hospital stays, and higher rates of hospital readmissions. Both healthcare providers and limited English proficient individuals indicate that limited language proficiency often delays access to available healthcare services and interferes with the development of a relationship between the patient and the healthcare provider, and impeding effective communication between them, leading to less than optimal care and dissatisfaction with the care received. Language barriers interfere with following through with treatments that are recommended by medical professionals, interfere with the use of preventative and screening services, further denying access to timely care, causing poor chronic disease management, and ultimately resulting in poor health outcomes. In education, in our increasingly complex world, communication between individuals and organizations, agencies, and systems is essential to navigating those systems, especially the special education system. For parents and families to be able to engage with schools as partners in their child's education, they need access to open and efficient communication with school and district staff, teachers, and administrators. Engaged parents serve as supporters of learning, encouragers of grit and determination, models of lifelong learning, and advocates of proper programming and placements for their children, with beneficial impacts on grades, test scores, lower dropout rates, and students' sense of competence and beliefs about the importance of education. When parents who have limited English proficiency cannot understand the information about their rights, their children's needs, and available services, they cannot effectively partner with educators or advocate on behalf of their children. And in disability and other human services, again, when individuals with limited English proficiency cannot find out information about the services for which they may be eligible, their rights in those systems, or how to access them, they are less likely to even apply for critical disability and other human services, leading to poor outcomes overall across all areas of their lives. So we can see from this information that it's very, very important in terms of outcomes for people with disabilities and their families that we provide effective language access. So we've talked a little bit about the reasons to do it, and now let's talk about the legal obligation to provide access. Any organization receiving funding from the federal government has to take reasonable steps to ensure that people with limited English proficiency have meaningful access to their programs, services, and information. So who has limited English proficiency? Any individual who does not speak English as their primary language and who has a limited ability to read, speak, write, or understand English is limited English proficient. And these individuals may be entitled to language assistance with respect to services, programs, information, and organizations and agencies that they encounter. Now, who has to comply? Well, state agencies, child welfare, juvenile justice, health and mental health agencies, developmental disabilities agencies, education, etc. Local agencies, including schools, private and nonprofit entities that receive federal financial assistance, like the SPAN Parent Advocacy Network, and subrecipients, that's entities that receive federal funding from one of the recipients listed above. Unfortunately, many of these organizations are unaware of their legal obligations to provide language access. So let's look at the sources of these requirements. Title VI of the 1964 Civil Rights Act says No person in the United States shall, on the ground of race, color, or national origin, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. And in an important US Supreme Court case, Lau v. Nichols, the US Supreme Court ruled that national origin discrimination, which is specifically included in Title VI of the 1964 Civil Rights Act, includes discrimination based on a person's inability to speak, read, write, or understand English. In addition, above and beyond the Civil Rights Act of 1964, there's Presidential Executive Order 13166, Improving Access to Services for Persons with Limited English Proficiency. This order covers all federal and federally assisted programs and activities, which must do a language access self-assessment and develop a language access plan. So those are requirements that are above and beyond the non-discrimination requirements of the Civil Rights Act of 1964. Under this executive order, there is an individualized assessment that includes a 4-factor analysis. So each covered entity, which includes the New Jersey Council on Developmental Disabilities and all of its programs and networks, must conduct an analysis of 4 things. First, the number of limited English proficient people eligible to be served or likely to be encountered, the frequency of contacts, the nature and importance of the service to people's lives, and the costs and available resources. So the first part of the requirement under the executive order is to do this language access self-assessment, and it includes several important components. The first part is looking at the demography of your catchment area. So the demographic profile of the population in the target area, which for the council is the state of New Jersey. It also includes a look at the languages that are most commonly spoken in that area by individuals who speak a language other than English at home and speak English less than very well. It also looks at any community-based organizations serving those populations with whom the council works. And the council is embarking on an effort to work with a much wider array of community-based organizations that serve families and individuals who traditionally have been underserved, including those who are limited English proficient. Section 2 is frequency of contact. So does the organization have a process to survey, collect, and/or record primary language data for individuals that participate in the council's programs and activities? And what categories of data are used? Where does the data reside, and who can access it? Section 3 is the importance of the activities. So the first question is, does the organization conduct compulsory activities? If yes, what are they? So the council does not conduct compulsory activities. They're not a school where you have compulsory attendance, but they do conduct programs and activities that have serious consequences. And so the question is, what are those programs and what are the potential consequences of lack of language access? So of course, if people with limited English proficiency cannot access the important information that the council provides about services for individuals with intellectual and developmental disabilities and their families, they could have very serious consequences for those individuals and their families. Section 4 is the resources. Have you identified the resources you need? Have you put those resources in place? Is there a staff member who's designated to oversee access to those resources? And if so, what's their name and title? Have you identified the places where LEP individuals interact with your organization? And is language assistance available at all of those points? And describe that access. Also under resources, how many employees speak a language other than English? What % are really bilingual and able to competently assist an LEP individual in their language? Do you use staff as interpreters? Or do you use outside individuals as interpreters? If so, what sources do you use and for what languages and how? Also under resources, Do you use family members as interpreters? If so, under what circumstances? And the answer to this question should generally be no, because family members are usually not trained interpreters. And also, if you use family members as interpreters, you might be sharing sensitive information with someone. Do you use minors as interpreters? The answer to that should always be no, because you can't really adequately address competency, confidentiality, appropriateness, and voluntariness. And someday, if you're interested, you can reach out to Johan Mora Valverde, who's on this webinar, to find out from him what it was like for him to have to interpret it for his parents, to ensure that they understood what was happening in terms of his own education and the education of his sibling. And then, are there resource limitations that could impact your ability to provide language access as required? And what are your resource options? Once you've done the self-assessment, the executive order requires the development of a language access plan. And we're going to talk today about the New Jersey Council on Developmental Disabilities Language Access Plan in a few minutes. So section 1 of the language access plan is the goals. So to whom do they apply? What's the expected outcome? When is the outcome expected to materialize? How will success be measured? And you want to address the language as well as the cultural context within which the services are provided. For example, for people from certain cultures, transition to adulthood may not mean the same thing as it does in the United States or in countries where the primary goal is individualism and independence. Section 2 is planning. So this is where the plan talks about how you're going to identify individuals with limited English proficiency, as well as your language assistance measures. So the type of language services that will be available, how staff can access those services to make sure they can serve LEP individuals effectively, and how to respond to LEP callers, written communications from LEP persons, and LEP individuals who have in-person contact with the staff. Also in the planning section, how are you going to train your staff to make sure that they know the procedures to work effectively with people who are limited English proficient, as well as with in-person and telephonic interpreters? And how are you going to provide notice to LEP individuals with signage, outreach materials, working with community-based organizations, a telephone voicemail menu, notices in public media, and as part of presentations to community-based organizations, schools, etc. Also part of the language access plan is monitoring and updating the plan. So the plan needs to have a process to determine on an ongoing basis whether new documents, programs, services, etc., need to be made accessible to individuals who are limited English proficient, and the impact of changes in demographics, programs, services, etc. In monitoring and updating the plan, do you have a written policy on when services, documents, etc., are translated and interpreted? If yes, is this information made available to the public? And if so, when and how? In what non-English languages? How are staff made aware and how often? And how are subcontractors made aware? Do they have a language access policy to guide the access that they will provide to persons with limited English proficiency? Also, as part of monitoring and updating the plan, how are you informing beneficiaries that they can access interpretation and/or translation at no cost? And at what points of contact? And do you ensure that interpreters and translators are qualified and understand confidentiality requirements? And if so, how? Just a reminder that translators translate written text and interpreters interpret spoken or sign language. And both of these are important. Also, as part of monitoring and updating the plan, is language capacity a factor in hiring? And how do you decide what languages? And how do you determine that a staff person is competent in that other language? What written materials do you provide to the public? Are they in other languages? Is the public notified of their availability? And if so, how? In what languages? Are there criteria to decide what will be translated into what languages? Who does the translation? How do you decide whether they're competent to do that? And do you do a second check on materials by actually having them read by people whose first language or whose primary language is that other language to make sure that they're understandable? You can't just really translate word for word from English to most other languages because they won't make sense. So the elements of an effective policy for limited English proficiency access is first identifying LEP persons who need language assistance, then identifying the ways in which language assistance will be provided, training the staff and your network, so volunteers, staff, board, others who help you fulfill your mission, providing notice to people with limited English proficiency, and monitoring and updating your policy on an ongoing basis. So let's talk a little bit about language assistance services. So there's written language services and translation of written materials. So written translation of vital documents are required for every language group that constitutes 5% or 1,000 individuals, whichever is less of the population of persons served or likely to be served. If there are fewer than 50 people in a language group that reaches the 5% trigger, the recipient does not have to translate all those vital documents, but does have to provide written notice in the primary language of that LEP group of the right to receive competent and oral interpretation of the documents free of charge. You can also hire bilingual and bicultural individuals from the community. You can provide oral interpretation services in person or through telephone interpreter lines. And you can also partner with community-based organizations and community volunteers. One of the things the council is doing as part of their diversity, equity, inclusion, cultural competence, and linguistic responsiveness plan is partnering with liaisons in targeted communities to help them reach out to community-based organizations that can help them provide more culturally competent and linguistic responsive services. Now, one of the most important things to note is that people with limited English proficiency cannot be required to pay for services required to ensure their meaningful, equitable access to programs, services, and benefits. And then section 3 of the plan is the evaluation. So a tool to collect data on beneficiary satisfaction with translation and interpretation services, checking to see if any grievances have been filed on a lack of language access, monitoring the system to collect data on beneficiary satisfaction and grievances, senior management using beneficiary satisfaction and grievance information to review the effectiveness of the plan, and then regularly updating the plan. Now, the Office for Civil Rights is the entity that enforces this requirement. And general OCR requirements include to develop that language access plan, to designate a staff person to coordinate Title VI activities, that's Title VI of the Civil Rights Act of 1964, providing information and training to staff and volunteers and others on these policies, posting translated notices that contain information on the availability of no-cost interpreters, maintaining effective interpreter services by emphasizing in-person interpretation and, to the extent possible, minimizing telephone interpretation, providing translation of important forms and documents, collecting, analyzing, and maintaining data to determine if interpreter services are adequately provided, and monitoring subcontractors and including a non-discrimination clause in all contracts for services. So the bottom line is ensuring meaningful and equitable access to the Council's programs, services, and benefits to children, youth, and adults with limited English proficiency. So now we're going to move from the legal requirements to the Council's language access plan. The Council's language access plan includes the policy of the Council, introduction and purpose of the plan, ensuring access to services and resources, responsible parties, the 5 areas of service delivery and programming, procedures for providing language access, and data collection and reporting. And the council's policy around language access is, it is the policy of the New Jersey Council on Developmental Disabilities to provide timely, meaningful access for individuals with limited English proficiency to all programs and activities. All personnel shall provide free language assistance services to limited English proficient individuals whom they encounter, or whenever an LEP person requests language assistance services. All personnel will inform members of the public that language assistance services are available free of charge and that the council will provide these services to them. Now, this is very important because it's not just the council that has to make this happen, but also their grantees, the people with whom they work, the regional family support planning councils, their self-advocate participants. All of the networks of the council have to comply with the policy of the council and the plan itself. So in the language access plan, following the discussion of the policy of the council around language access, you have the introduction and the purpose, information about the council, demographic data from New Jersey, which we discussed earlier in this webinar, how the council will ensure language access to services and resources, who's responsible for making sure that happens, areas of service delivery and programming, procedures for providing interpretation services, and procedures for providing translation services, data collection and reporting, and evaluation and revision of the plan on an ongoing basis to make sure that it's up to date. If you look at the census data for the most recent census, you'll see that some languages are more common today than they were 10 years ago. In the discussion of service delivery areas, it includes the fact that there will be an assessment of individuals and families of individuals with intellectual and developmental disabilities, language access needs, and the council's capacities. Translation of vital documents into the limited English proficient languages in the state as soon as possible, but no later than within 1 month of development, and earlier for vital documents with deadlines, such as dates to apply for programs or for requests for proposals. They describe a vital document as including outreach and educational materials that the council uses to inform the public about their rights or available training, technical assistance, and support services, and also that it applies to all council contracts, vendors, and grantees. There's also a discussion about the provision of oral languages services through referrals, partnerships with community-based organizations, and the language line. And this includes the posting of multi-language signage in public contact places, asking LEP individuals to identify the language that they need in physical workspaces, as well as during functions of the council, such as conferences, meetings, and training, including on online platforms. They will use bilingual staff, telephonic interpretation, contract interpreters, or community or professional services, and will not use children or family members unless the family members are requested by the person with intellectual and developmental disabilities or their family. The council will maintain a list of its bilingual staff who are willing to provide interpretation services, as well as a list of the more common languages encountered in the state. The council will not allow minors to provide translation or interpretation services and will not expect an individual or a family that will translate or interpret for themselves. And then the last bullet is that the council will conduct ongoing outreach and community engagement activities that target populations of individuals with limited English proficiency. And this will include providing LEP communities with information about the benefits of the council, their services, and their plan, as well as that of DDAC partners and other community resources, and soliciting input and feedback from individuals with limited English proficiency to determine the effectiveness of the language access plan and update it as needed. The council will assess the language access needs of individuals and families of individuals with intellectual and developmental disabilities. It will provide notice to those individuals about how to access interpretation or translation services. It will translate those vital documents into all of the LEP languages largely served by the council. And it will also provide oral language services through a multitude of resources, including bilingual staff and use of the language line. That ongoing outreach and engagement with LEP communities will include a memorandum of understanding that the council will be signing with the New Jersey Alliance for Immigrant Justice, where virtually all of the immigrant serving organizations in the state belong, and those organizations serve many individuals with limited English proficiency. So that partnership will be very helpful to do outreach and engagement with limited English proficient communities. Collection and analysis of the data on LEP services, an annual evaluation of the plan and revision every 3 to 5 years, and staff training to enhance the capacity of the staff to effectively provide language access to and serve LEP individuals. In addition, the council is having this webinar so that all of its networks and new council members or new staff will be able to understand both the requirement to provide language access and the council's language access plan. The plan also talks about how language access will be coordinated. So in terms of overall implementation of the plan, Mercedes, as the executive director, will have overall responsibility to ensure implementation of the language access plan. She will be supported by team members who will have specific responsibilities based on their other council responsibilities. So as part of this language access coordination section of the plan, there will be a training program on the plan will be developed and implemented. Policies and procedures for the council will be developed, and those will be maintained and updated as needed. The council is getting ready to implement a new data system that will be able to gather and report on information on many more categories that are available now, including the language access needs of the people who are contacting the council and using its services. It will acquire, compile, and report statistical information on language access to the New Jersey Office of Language Access on behalf of the council. And it will coordinate and maintain multilingual listings on employees who volunteer to assist with interpretation and translation services. In addition, it will create an office notice in multiple languages so that people who speak languages other than English will be able to see in their own language how they can get interpretation or translation. They will handle requests for written translations in a timely manner. They will coordinate all of the delivery of limited English proficient services when necessary, respond to any inquiries or complaints regarding the plan, monitor the plan and the accompanying council policy and procedure, including submitting an annual report to the head of the organization beginning this year, addressing the organization's success in providing meaningful access to the council services and programs for individuals with limited English proficiency, and also provide liaison services to the Office of Language Access. So who does what under this plan? Again, Mercedes Wachowski, as the executive director, is responsible for overall implementation and monitoring of the plan. She and her staff will ensure access to technical assistance activities. The administrative assistant will ensure that staff and council members are aware of how to use the language line. And this will also be important for members of Regional Family Support Planning Councils, or the chairs of the Regional Family Support Planning Councils, the facilitators of the self-advocate groups, etc. The council's communication officer will ensure that workshop support materials are translated into needed languages, maintain the contract with the language line, and ensure that the website is accessible in multiple languages. Council staff will ensure that workshops are available in multiple languages as needed. Council staff with communication officer will ensure that the products that are developed by the council are translated at least into Spanish, and for considering the need to translate into other languages. And in terms of language access resources, you can find the council's language access plan at this link. There are other language access resources, including the Language Assistance Self-Assessment and Planning Tool and Assessing Access Worksheet by the Interagency Working Group on LEP, at lep.gov. And that's the tool that the council used to do its own language access self-assessment and develop its plan. A tip sheet on working with interpreters, a guide on growing your capacity to engage diverse communities, and the cultural and linguistic standards by the U.S. Department of Health and Human Services, which has information on requirements for grantees of the U.S. Department of Health and Human Services, which the council is one of, on how to provide not only language access, but also culturally competent services. In addition to its own language access plan, the council can serve as a language access advocate. And what can it do to improve language access for individuals with disabilities and their families from government agencies, service providers, and other family organizations, as well as other nonprofits? The council can be a leader. It can educate agencies, providers, individuals, and families on their limited English proficiency rights and responsibilities, and advocate with individuals and families to ensure that agencies meet their obligations. And I know that in the past and moving forward, the council has and will continue to advocate with relevant state agencies to translate more materials and provide better language access. The council can be a leader in building organizational capacity to provide quality interpretation and translation. It can engage diverse families as council members, staff, and as volunteers, and develop a bilingual, bicultural workforce. It can build coalitions and partner with diverse community-based organizations. And there are many other things that it can do. And if for council members, council staff, and members of the council networks like the Regional Family Support Planning Councils and self-advocacy groups, should also be thinking, how else can you provide language access to make sure that individuals with intellectual and developmental disabilities and their families have language access to all of the council's supports, information, and programs. So I'm now going to see if there are any questions that anybody has about this presentation. Does anybody have any questions either about the responsibility to provide language access on the part of the council or the council's language access plan? All right, so I'm going to stop sharing. And the last thing that I'm going to do is I'm just going to take you to the council's website section that talks about language access. So if you go to the council's website, you can go to NJCDD and go over to language access plan. And here it will take you to the language access plan, the policy of the council, the language access plan, which you can download, has the whole plan here.
Diana,
Yes. Yes.
are you
Okay, I
looking
should
to
be
share?
sharing. Yep, I should be sharing. Sorry.
No problem.
Here on my screen. So this is the page where the council has its language access information, as well as a wonderful document, which is a plain language document about the language access plan, which you can access from this page on the council website. So at this point, I'm going to see again if there are any questions or comments. And thank you, Kyoko. And seeing no other questions or comments, just will say that we will, the council will include the recording of this webinar as long as the PowerPoint on their website, so that people will be able to access it at any time, 24/7. And we also will be providing information on other aspects of the council's diversity, equity, inclusion, cultural competence, and linguistic responsiveness plan in future webinars, which also will be available on the council website. Thanks everyone for joining, and I'll say goodbye.